It looks like they do here. So I'm going to go ahead and get myself ready. I'm going to get a pair of gloves, and I'm going to get some alcohol and my supplies ready. So I'm going to go down to my patient's room. I'm going to knock on their door. I'm going to introduce myself. I'm going to identify my patient. I'm going to have them either do their name and date of birth or two identifiers, something to make sure I have the right patient. I'm going to let them know what we're doing. We're going to just DC this continuous line and leave the IV in place. And I'm going to let them know that we're going to do that in case they need medications or they need to restart an IV. We want to already have that in place, so we're going to just leave it alone. So I'm going to wash my hands first. And then I'm going to get my gloves on. I'm going to access the IV site if the bed needs to be raised, if the patient needs to be positioned. I'm going to do all that stuff to make sure everything's done. I'm going to go ahead and loosen up the tape here. And I'm going to talk to the patient, and see how they felt with this and make sure they're not having any irritation, burning, redness, swelling. Everything looks good. So we're going to clamp off this tubing here. And then I'm going to untwist this here. DC this from them. Once I have that out, I'm going to hang this up here. I'm going to use my alcohol, and I'm going to wipe this off, make sure that's all clean and taken care of. Discard my garbage. And I'm going to make sure I teach the patient how to take care of this. Be really careful they don't catch it on anything because they could pull it out easily. If there's any signs of redness, swelling, anything going on, that they report that to us. And then once I'm done with that part, I'm going to go out and I'm going to document what I need. This next part of the video is going to be inserting a medication into an IV lock. So we're going to gather our supplies that we need. We're going to check the records, make sure that the MD and the MAR match. It looks like they both do. So I'm going to make sure, I'm going to wash my hands. I'm going to prepare my medication. So I have a 3 milliliter syringe here. I have my medication vial, and with my medication vial I want to make sure it's not expired. I want to make sure there's no particulates in there and that everything looks good. I'm going to get my little flush syringes here so I can have some flushes and my gauze pads here. I'm going to open all this up, get everything ready beforehand. Okay, and then when I'm done getting everything ready, wash my hands. I'm going to apply my gloves. And once I have those on, I'm going to pull back some air into my syringe here, the correct amount that I'm going to be taking out. I'm going to wipe my medication vial with my alcohol. I'm going to insert my syringe, put the air in there, and then I'm going to pull back my medication. If I have bubbles in here or anything, I can just kind of flick them out. I can use a pen, whatever I need to do here. So I'll get those out. And then I'm going to recap my needle. So I'm going to get that on there. And then I have this and my stuff ready, so I'm going to go down to my patient's room. So I'm going to take off my gloves, take my stuff down to the patient's room. And when I get into my patient's room, I'm going to knock on the door, identify myself. I'm going to identify my patient with two identifiers. When I've identified my patient, I'm going to make sure that my medication is correct again at the bedside before I give it. I'm going to make sure that the IV site still looks like it's okay. And once I make sure that everything's okay, I'm going to wash my hands. I'm going to put on my gloves. And I'm going to talk to the patient, see if they have any concerns or anything they need to know. Once I'm done with that, I'm going to clear this off with alcohol. I'm going to use my flush here. And these little flushes, if they have air bubbles, I'm going to squirt the air out. And then I'm going to put it on here. And I want to flush this with about 5 milliliters. And that's going in nice and easy, so I know that's okay. Before I do my injection, I want to clean this again with alcohol. I'm going to uncap my needle here. And I'm going to make sure that I put this right in the center. Once I get that in, I'm going to do a slow push in here. Make sure that my medication's going in. Once my medication's in, I'm going to take this out and I'm going to discard this in my sharps container. And then I'm going to do another little flush to make sure we got that through. So I'm going to wipe this side again with the new alcohol pad. If there's air, I'm going to get rid of it. And then I'm going to flush that side again with 5 more. And make sure that it's going into the arm, which it looks like it is just fine. I'm going to do that. And then when I'm done, I'm going to discard of all my supplies. I'm going to notify the patient if they have any issues, to call right away. But I'm going to stay with the patient for just a few minutes and make sure that that medication doesn't have any adverse reactions. And then once that patient is taken care of, I'm going to step out and I'm going to document the medication that was given, the patient that it was given to. I'm going to make sure that I do the time, the dose, the route, everything that needs to be in the chart. I'm going to document it. And that's it for this step. Okay, I'm going to be doing a discontinue of an IV, so I'm going to make sure that I gather my supplies first, and I'm going to check the MD record and make sure that we need to have it done. So I'm going to check, it's all in here, they want it DC'd, so I'm going to go to my patient's room, I'm going to knock on their door, I'm going to identify myself, I'm going to identify them, make sure I have the right patient using 2 identifiers. If everything is correct with the patient, I'm going to make sure that the site still looks good. I'm going to talk to the patient, tell them what we're doing, why we're doing it, and then I'm going to wash my hands. I'm going to put on my gloves. And I have my supplies here with me. And I'm going to open this up here and get it ready. And I want to get my tape ready here real quick too. So I'm going to undo this real quick here and kind of hold down on the skin while I'm undoing the tape. And get all this off of here. I'm making sure to hold this still in place while I'm undoing all this tape. And once I get the tape undone here, got that all taken care of, I'm going to take my gauze and kind of wrap it up here. And I'm going to kind of hold down here while I pull out. And I'm going to put the new gauze over top, and I'm going to apply some pressure just for a couple minutes here so I can make sure that the patient isn't going to continue to bleed. And once I'm done with that, I'm going to take off my gloves, I'm going to wash my hands, I'm going to make sure my patient tolerated that, and then I'm going to step out and document what was done.